Dry eye is when we don't get enough fluid maintaining on the surface of the eye. A lot of patients, I'll say, you have dry eye, and a lot of times they say, Doc, you don't know what you're talking about because my eyes water excessively. They're always watering. They're not dry, they're wet. And I tell them, well, your body likes to fix problems. And when your eyes are dry, your body tries to fix it by watering excessively. Dry eye is when we don't get enough fluid maintaining on the surface of the eye. And there's a couple different reasons that can cause it. If we don't have enough oil in our tear film, the water can evaporate a little too quickly. If the drainage holes in our eyelids are too large or aimed directly towards the eye, it can suck the water off the eye a little bit faster. So these people who come in with dry eye have less water content on the surface of their eye. It can cause symptoms of burning and itching. It can also cause excessive watering, like we already stated. It can fluctuate your vision quite a bit also. So we've had patients that undergo eye surgery and they complain that their vision's fluctuating afterwards, but it's not the surgery that's the problem. It's the dry eye that's caused from the surgery, which almost always heals after a couple months. Anything that can influence the stability of the tear film on the surface of the eye can exacerbate the dry eye symptoms. So, for instance, people would wear contact lenses, and contact lenses are mostly made out of water. So if you put something that's craving water on the surface of your eye, many times it'll steal the water off your eye to hydrate itself. But after it's no longer able to hold that water, it evaporates, there's no water left, so it can make your eyes even drier. Environmental factors can also influence it. In the summer, we use air conditioning. Air conditioning can dry out your eyes. In the winter, we use heat. We do find that people with forced air heat or even wood stoves suffer dry eye more often than people with baseboard heating. So eye drops are not all the same. So when you have eye drops to treat dry eye, you have lubrication eye drops, which are the ones that you find on the shelves, Refresh, Sustain, TheraTears, which are fantastic in adding a lubricant to the eye at that moment. They try and keep that eye drop on the eye as long as possible by adding methylcellulose and different components to it. But a lubrication eye drop really only lasts 20 minutes to a half hour in the eye before it dissipates. So there are treatment modalities. There are medication eye drops, such as Xiidra, Restasis, Cequa, and those medications are designed to either put more oil in the tear film to keep the water from evaporating or decrease inflammation on the surface of the eye, because dry eye is noticeable from the symptoms. And the symptoms of dry eye come from inflammation on the surface of the cornea. So we have medication eye drops that decrease inflammation, that increase oil production on the eyes. We also have an eye drop that's brand new called Mibo, which is a barrier medication. And it's not a medication that actually alters the physiology of your eye, but what it does do is it holds the tears on your eyes so it doesn't evaporate. And if you put an artificial tear in your eye, it can pass through the Mibo to the eye, but it doesn't come back out again. So it, in a way, holds the fluid on your eye longer. There are other medications out there, such as Tervaya, which is a nasal spray, which stimulates a nerve to put more tears in your eye also. So that's just another tool that we have in our arsenal to fight against dry eye. Another thing that I like to use, which is not something that's external like a eye drop or a medication, is punctal plugs. A punctal plug is a collagen insert that we can push right into the hole of the drainage system of the eye, which kind of stops the drain. It's a stopper. So it keeps the water on your eye longer also. And many times we'll use both a punctal plug and we'll use one of these medications to put more oil in your tear film to hold the water on your eye because it can't go down the drain and it can't evaporate as quickly. Another thing that I've been using a lot more recently is prescription strength fish oil pills. These omega-3 pills also thicken the tear film by adding more omega-3 into the tears. And omega-3 is really good because it's like a looser lipid surface versus like omega-6. Omega-6 is a oil that's in our bodies, but it's really thick. It's almost like lard, and it can clog the glands of our eyelids more. Omega-3 is in the same kind of composition as a waxy material in the eye, but it's a lot more fluid. It's less viscous. So it's a lot like having olive oil in your system versus lard.